Hey there, welcome to Straight Talk. We've got a great show lined up today. Lisa and I will be discussing the topic of sexual responsibility.
That's right, Jason. Today we're going to cover the basic facts about reproduction,
choices you'll be faced with,
and the consequences of those choices. Okay, let's begin with the basics.
Each of us needs to understand what happens to the body during the reproductive process.
Yes, and it's important to know what happens in both the male and the female body.
The job of the reproductive system is to make new human beings. In the male reproductive system, there are two primary parts, the penis and the testicles. The penis is a tube-shaped organ near the pelvic bone at the front of the body. Behind the penis are the testicles, two egg-shaped organs carried inside a pouch of loose skin called the scrotum. The testicles produce and store male reproductive cells, which are called sperm, or sperm cells. The sperm duct is the passageway for the sperm to travel from the testicles to the penis. The urethra carries the sperm through the penis to the outside of the body. The urethra has another job. It also carries urine to the outside of the body, but the urethra never carries urine and sperm at the same time. Normally, the penis is soft. However, for sperm to be released from the body, the penis must become erect. An erection is a stiffening and enlarging of the penis. In sexual intercourse, the male inserts the penis into the female vagina. When sperm is released, it travels through the female uterus to meet the egg cell in the fallopian tube. When a male sperm cell combines with a female egg cell, a fertilized egg is formed, which means the woman is pregnant.
Very interesting, Jason. Now let's look at the female reproductive system. The largest part is the uterus, or womb, a muscular organ located in the center of the abdomen behind the pelvic bone. On each side of the uterus is an ovary. Ovaries are connected to the uterus by fallopian tubes. The uterus leads to the vagina, a hollow tube that connects the uterus to the outside of the body. The ovaries store female reproductive cells, called eggs or ova. Approximately once a month, beginning in puberty, an egg is released into a fallopian tube. The release of an egg is called ovulation. During a month's time, the uterus builds a soft lining of blood and tissue in preparation for a fertilized egg. If the egg is fertilized, it will attach itself to the wall of the uterus, where it will be protected and nourished for 9 months as it grows into a baby. When the time is right, the baby will leave the uterus and pass through the vagina to life in the outside world. If the egg is not fertilized, it does not attach to the uterus wall. The built-up inner lining dissolves and slides off the uterus wall. Over a period of 3 to 7 days, the blood and tissue from the lining and the unfertilized egg flow out of the body through the vagina. Then the cycle begins again. This process is called menstruation. These are the basics of the male and female reproductive system. Today's topic at Straight Talk is sexual responsibility in relationships. And now we want to hear from you with any questions or concerns you have.
Right now we've got an email from Charlie in Illinois. Dear Jason and Lisa, I've been a really good friend with this girl for 2 years, but now I'm starting to think I like her as more than just a friend. Do you think I'll scare her off if I tell her?
Well, that's the best way to start a relationship, as friends first.
Definitely. Often feelings evolve into something more.
Charlie, the best way to find out is to ask her. Simple as that.
She might be flattered. She could feel the same.
If she doesn't feel the same, I'm sure you can talk about it. She's your friend, right?
Let's take a look at a couple who were friends first.
What a day.
Tell me about it. What happened with you? Everything's okay, isn't it?
Yeah, I'm fine. I just had 2 tests and a pop quiz. I definitely need a break.
We can watch a movie tonight. I don't think my parents will care if we take over the TV.
That sounds perfect.
Those two look like they really care about each other.
Yes, and they must have fun together. They appear to be good friends.
Which is what a caring, healthy relationship is. Good friends.
If you're not friends, how will you communicate? Having a mature, meaningful friendship makes being a romantic couple so much more fun.
and so much more successful.
We have a caller on the line this time. Brittany from New Mexico.
Hi, guys.
Hi, Brittany.
Hi, Brittany.
Okay, there's this guy I like, and, I can't even talk to him when I'm around him. I'm so nervous. How do I stop this? Am I always gonna look so stupid?
First of all, it's normal to be nervous.
I know what you mean. I used to get so tongue-tied.
Well, you obviously don't have that problem anymore. But let's see what Kaylee and her friend are talking about.
Christina, guess what? I'm going to Ben's tonight to watch a movie. I have total butterflies. You're nervous? But why? I don't know. Whenever he puts his arm around me or holds my hand, I get a zing. Sounds as if you have a case of the love bug.
Oh, that's such a nice feeling to have.
Uh-huh. You feel happy, like walking on air.
But a little stressed and nervous at the same time.
Normal and natural.
Yes. In fact, these new and confusing feelings and emotions are a direct result of hormonal changes during puberty.
You may feel like you need to respond to these new feelings.
Because they're exciting and you may feel giddy with happiness.
But you don't have to actually do anything.
That's right. Take your time in deciding how to respond.
Another question, by snail mail this time, is from Alexandria from Texas.
Alexandria writes, if you like a guy and he likes you, but he wants to make out all the time, how do you tell him that you only want to make out a little?
Well, it sounds like the real question is how to draw a line.
Right. For instance, you may feel comfortable with holding hands, but not kissing.
And how do you say one's okay, but not the other?
It's important to remember that when it comes to your body, you never owe anyone anything.
Except you owe it to yourself to stay within your own comfort zone.
Even though you may feel like you want to do more.
You may not be comfortable with acting on that feeling.
Exactly. Let's see what's happening with Ben and Kaylee.
Hello there.
Why, hello, darling.
Hey,
What'd I do?
please, what did you do? Hey, stop.
What?
Stop grabbing me.
Okay, relax. I'm sorry.
The relationship is getting more complicated, and Kaylee's not sure how to react. She's uncomfortable, but she doesn't want to chase him away.
When you reach the point when something bothers you and you don't feel comfortable, you have to speak up and say so.
Yes, and do so right away. The other person will be less offended when you say no immediately.
And here's Josh calling from Missouri. Hi, Josh.
Hi, Jason.
What's on your mind, Josh?
Well, it's my friends. They all keep asking me when I'm going to convince my girlfriend to have sex. The thing is, I don't feel like I should convince her. Shouldn't she decide for herself?
Well, I don't know why you're calling us. Sounds like you have it all figured out.
But his friends are making him second guess his own beliefs.
And that's called peer pressure.
Yes. Josh, I think you've decided what's right and what's wrong for you, but you're experiencing pressure from your friends.
You have to stand your ground and do what you believe is right.
Not what friends think is right for you.
Yes, you're probably right. I guess my friends are getting to me.
See, it's not too difficult.
Let's see what happened earlier in the day when Ben spoke with his friend Joe and encountered a situation similar to Josh's.
I heard Kaylee's coming to your house. Sounds like you're getting lucky tonight, man. Man, I wish I were you. Becky and I broke up last week.
Oh, yeah?
Yeah. But I'm trying to get Michelle to go out with me.
That's a case of peer pressure.
Yes, indirect peer pressure.
Notice how Ben didn't say he would have sex with Kaylee.
But he didn't necessarily deny it either.
Right. It's a good idea to figure out how you'll handle a situation like this before it ever happens.
Think ahead about what's important to you, why you choose to act a certain way, and decide how you'll stick with your beliefs when they're challenged.
Good words to live by in any situation. Let's take another caller.
Okay. We have Jake from Florida. Hi, Jake. What's your question?
Well, my girlfriend wants to have sex. When she told me, I said maybe we should wait. But she keeps talking about it. What should I do?
Good question. One that comes back to the point we just made with Josh.
This is another case where you should think ahead. Know what your beliefs are and what your decisions will be before they're needed. It'll be better than making it up as you go along.
True. Being forced to make a decision on the spot won't result in the best outcome. Let's check back now with Kaylee and Ben.
Maybe we could make tonight the night.
The night? What do you mean?
Well, I just thought that since we've been together for a while now that we could,
Then, just because we've been dating a while doesn't mean we should have sex.
But everyone's doing it.
I don't care what everyone else is doing. I've already decided that having sex isn't something I want to do right now.
But don't you want to be a serious couple?
Kaylee certainly thought about this situation. But is Ben's point about being a serious couple valid?
Well, I think Ben is confused about what defines a serious relationship.
I agree. A couple needs to be in a serious, committed, healthy, and mature relationship before they have sex. Not have sex in order to be a serious, committed couple.
It's a very good point, Jason. Now we have a letter from Lauren and her friends in Colorado. Can you get pregnant the first time you have sex? Can you get pregnant during your period?
Absolutely. Yes and yes.
Anytime you're involved in sexual behavior, you run the risk of getting pregnant.
Having sex is a very serious decision, and pregnancy is only one of many serious consequences of that choice.
In Kaylee and Ben's situation, Kaylee may feel like she wants to have sex with Ben,
but she's thought about the consequences and doesn't want to act on her feelings because of those consequences.
Right. She's putting those butterflies and zing feelings aside. Take a look.
Then, I could get pregnant. Believe me, that's not something we want to happen.
We'll be careful.
Yeah, careful. By not having sex. I mean, accidents happen, and I don't want a baby to be one of those accidents.
Think about how having a pregnancy or baby would change a person's life forever.
And we mean forever.
Not only the mother's life,
but the father's life too, and their families.
Not to mention the new life that is just beginning.
The responsibility is enormous. The financial burden is, well...
a burden.
And everything planned for the future will be changed.
With a baby, there might not be the time or the money to go to college.
It would be difficult to find the time or energy to be with friends.
A teenage parent would probably be home alone, changing diapers while friends are out having fun.
Now, our viewers may be thinking that there might be options if a person gets pregnant.
Talking to a parent or another trusted adult would help to understand possible options. Any option would require a life-changing decision.
I believe we have another email from one of our viewers. From Tamara in Connecticut.
Dear Lisa and Jason, what are STDs?
Quite frankly, there are a lot of STDs, or sexually transmitted diseases. HIV, which leads to AIDS, is obviously the scariest one and the one you hear the most about.
But some other common STDs are herpes, chlamydia, gonorrhea, syphilis, and genital warts.
Herpes is the result of a virus and can cause blisters on the genital area. Even if blisters are not visible on the skin, the virus may be active in the body. Once a person is infected, he or she is infected for life.
Chlamydia is caused by a bacteria and is hard to diagnose. It can cause pelvic pain, infertility, and puts the person at an increased risk for HIV.
Gonorrhea is also caused by a bacteria. The bacteria can grow and form sores in the eyes, mouth, anus, urinary tract, and the reproductive system of males and females. It is spread by sexual contact that does not have to include sexual intercourse.
Syphilis, too, is caused by bacteria. It shows many symptoms and may be passed from one person to another by contact with a syphilitic sore in the vagina or on the penis. Women who have syphilis may not know they have it because the sores are inside the vagina.
Genital warts, caused by a virus, can infect the reproductive tract of males and females. It is the major cause of cervical cancer.
Many STDs are very dangerous and some potentially fatal.
A sexually active person should visit a doctor at least once a year for an examination. Some STDs may be treated with antibiotics.
The human immunodeficiency virus, or HIV, is spread through the blood, semen, and vaginal discharges of an HIV-infected person.
The HIV infection may be contracted by engaging in sexual behavior or drug use.
Also, HIV-infected women can pass the virus to their newborns during pregnancy and childbirth.
A person does not get HIV from touching someone or holding someone's hand,
or from kissing or drinking from the same glass.
The important thing to remember is that HIV causes AIDS and can affect anyone.
One thing we want to stress to our viewers is that regardless of how responsible you are, when you make the decision to have sex with a person,
you're making the decision to have sex with anyone they've ever had a sexual relationship with.
There is no way for you to know how responsible your partner has been in the past.
That's right. So you see, when you think about it, having sex is a very big decision. And Kaylee has thought about it.
Ben, look, I want to be serious about us, but I know I'm not ready for this. Why don't we just date and have fun and not worry about it?
Yeah, I guess you're right. I don't want to push you, and I definitely don't want you to be pregnant or have to worry about STDs.
So you see, it's okay not to have sex. It is important to talk together, as Ben and Kaylee have.
A couple will feel much better about the decision.
And will be much less likely to allow peer pressure to influence their actions.
Let's take one more look at Ben as he runs into Joe again at school.
So, Ben, how'd it go last night, man?
You know, Joe, that's not something I really want to talk about.
Okay, see you later, man.
I'm glad Kaylee and I talked about it, and I'm glad we decided to wait. It's better not to complicate things.
Congratulations to Ben. Ben and Kaylee have made a thoughtful choice that will result in positive consequences.
And that wraps up this edition of Straight Talk about sexual health, choices, and consequences. Until next time.
Bye.